I'll be talking on IT in modern healthcare organizations, best practices and solutions. I work for GE Healthcare IT India. I'm the clinical director. This is the agenda I'm following today. What is the need for healthcare IT? We've been hearing since yesterday morning a lot of nice speakers pitching various angles, and Aniruddha was talking about the need for patient privacy, and a lot of details were coming up. So I thought I should give it a consolidated view and put it in a format where I tell you, in my view, what I think is there is a need for healthcare IT. Some benefits, proven benefits, which we have seen across the world, doing scientific research with data. What is the India healthcare landscape? What are the opportunities as we speak today evolving in India? eHealth, which is a central government-led project, soon to be launched in September, and GE Healthcare IT India, the products that we are having in the market and plan to come out with as we go along. A brief introduction about myself. I am a medical doctor, 20 years of medical experience, passed out from Madras University with MBBS. I have experience in neurology, emergency medicine. I have my master's from health informatics in UK, and I've been working with GE through engineering, ITPS, and now I'm the clinical director. So I think I understand a little bit of this complex and complicated field of health informatics, coming from the clinical domain as an end user, knowing what we look forward to, coming from the engineering side, knowing the pitfalls and the problems, and what we ask is not always doable. So what is the need for healthcare IT? I'll start with this slide, which talks about 100,000 hospital patients dying yearly due to adverse events. This study was done by the Institute of Medicine in 1999 and repeated in 2001 with almost the same results. This, you can say, is the starting point for people to sit up and realize, yes, we have a problem here, a serious problem. 100,000 patients dying in a hospital due to adverse events is a huge number. In the US, which is supposed to be the best place for healthcare, these are some of the challenges as practicing doctors we have to face today. Medical knowledge swamps us. This deluge of information, there is so much information coming up that it's physically impossible for us to keep up with this. Digital data overload is happening. We are bombarded with so much of images, and we are supposed to be on top of all of this. Clinical practice variations till now was happening, but now we know that there is a cost behind it. So if I turn up with a heart attack to one of the hospitals in Hyderabad, I should get more or less the same standard of care. But currently, it is left to the clinician's training, where you are trained from. If you are trained in the US, you treat the patient in a certain way. If you are trained in UK, you treat the patient in a certain way. Now, none of them is wrong, right? This is where the catch is. As clinicians, you have to tailor-make the solutions to your patient's individual needs. But the variations in clinical practice has a cost attached to it, and there is a need for standardization of the clinical practice itself. And healthcare IT is at the core of solving these problems. An interesting graph here showing how the knowledge processing capacity is always the same. Many years ago, you can say in the 80s and 90s, or even before that, the amount of knowledge which was there was just below how much we could digest. We know what happened after internet, Google, Bing, and all these things turned up. Right? Knowledge is just going up through the roof. And that gap, research has shown that this gap injures patients. We practice medicine today in the 21st century using cutting-edge technology, but look at the data we have. It's built on the 19th century information approach. In medical informatics, data is key. When data is organized, we get information, and out of information, knowledge comes. Knowledge again gives you more data. So if the data itself is not available, there's no way the other steps can happen. Technology is available today which can extract data from free text notes. We are in an age where we are talking about the semantic web. You can write any number of data. Look at this example. We are talking about tobacco, and the system is able to pick out words and map it and say that this is probably a smoker, this is a non-smoker. There are challenges. Lactobacillus, there is TOBA in that. So the system doesn't know whether this is tobacco or not. But very soon this also will get resolved. Some of the healthcare issues which are major problems today, the doubling of medical knowledge, what I said, and what we call as the bench to bedside or the evidence to practice takes 14 years. 14 years is a long time for evidence to come down to practice. The chronic disease burden across the world is increasing. We are living long, and the longer we live, we are having more problems. And chronic diseases, diabetes, hypertension, the lifestyle diseases, adding to our budgets and adding to our problems. Quality concerns are there because patients receive best treatment less than 55% of the time. So it is becoming important now that patients get quality care. And the unnecessary variations which I mentioned, high regional variations are there. And one of the reasons is because poor data sharing happens across healthcare organizations. We all know that. If you go to two hospitals in the same city, you probably have to redo all your medical blood and investigations, all your tests, simply because data is not, it's not possible for data to flow across from one organization to another. Take imaging, be it cardiology, radiology, pathology, the amount of images is going up. Image management is becoming a very big issue because the turnaround time, patients and everybody wants to shorten the turnaround time, but it's a constant challenge to keep up, keep the turnaround time low and at the same time keep up with the amount of images which are coming in. This is a slide which shows that between 93 and 2005, in about 10-12 years, the number of genetic tests which are available for one to do has increased so much, and there's only one way this is going. It is increasing day by day. So we are in an era where practicing medicine the way we practice today is no longer acceptable. 500 milligram paracetamol 3 times a day is acceptable for an adult dose today. Very soon it will not be, because the liver in each of us synthesizes the paracetamol in different ways, and we are in an era of personalized medicine. So very soon each one of us can have a genetic profile, and the clinician would have to individualize the treatments based on the genetic profiles. Patient self-help groups are becoming more and more important. These are very true for chronic diseases and the so-called killer diseases like cancer, HIV. These are all now manageable. They are treated more as chronic diseases now. These patients live longer, so they form self-help groups amongst themselves, and there is best practice sharing amongst them. So who are the drivers for healthcare IT? This is a very strong segment which is actually driving healthcare IT, because they need to know, and patients are partners in the care when it comes to chronic diseases. Some of the benefits I'll talk about. One example here saying how on paper 1 gram Rocephin IV translates when it is digital with improved clinical information, and this study was published in the New England Journal of Medicine. Look at the numbers which are there. 70% drop in the hours of antibiotic therapy, 40% drop in the number of days in hospital, and 40% drop in the cost for hospital. These are real numbers which shows using IT, giving intelligence at the point of care, at the point of prescribing, has tangible benefits. 55% reduction in adverse events, medication error after computerized physician order entry was implemented in this case. Clinical data exchange has in this study showing that everybody can benefit. Providers, payers, laboratories, radiology centers, pharmacies, and the total number is something like 337 billion. One of our customer examples where it is a digital hospital and completely filmless, cableless, paperless hospital. When a study was done before and after on comparison